Hi, my name is Jenny, and welcome to Beating the Odds Conference Conversation. Real stories, bold insights, and unforgettable moments. I'm here with Dr. Heather Lannon, a researcher and a person of lived experience. Today, we're going to start to ask her a few questions about her perspective of women's heart health. To start, as a researcher, why do you think it's important to include women in more heart and brain research?
Well, thanks for having me, Jenny. I'm so excited to talk to you about this. That's such a big question, but I really think that having somebody at the table who has lived experience, whether that's a caregiver, a patient, somebody there who actually has lived through either a transplant or experienced heart failure or had some type of cardiac incident is huge. That perspective is critical to making research robust, making it impactful, and really enhancing the patient's voice at the table and bringing everything kind of to fruition. We have all this education and we have training and we have skill, but having that extra piece is just like the cherry on top. And I think it really makes research more impactful for all.
Thank you for that. Do you feel there are still gaps within research for women in specifically?
Yeah, absolutely. I think we've come a long way, like looking back to when I was a patient partner myself, which was like 10 years ago. We saw very few patient partners at the table or being involved in research teams. We saw them more as participants being studied versus individuals who were actually actively engaged in research. So we're slowly moving the needle. We're getting there to a point where we're seeing individuals with lived experience, like today, on stage, co-presenting with the researchers. We see them participating in the recruitment process of studies. We see patient partners helping with the study design or coming up with research questions. So I think we're moving forward, but I think we still have a long way to go in able to fully have patients engaged. And, it'd be great to see a patient on the stage for every single one of those presentations or on the posters as a co-author.
Absolutely. I agree. Thank you so much for your insight. I do agree that the needle is moving, but we definitely have a long way to go. Thank you so much for joining us
Thanks for having me,
today.
Jenny.
Thank you.